Hello friends, today we are going to discuss arches of foot. We know that foot, it acts as a segmented lever, and due to the presence of tarsals, metatarsals and phalanges, it is easy to adapt on the uneven ground. The two types of arches that are present in our foot, these are medial longitudinal arch and the lateral longitudinal arch, and a series of transverse arches which are specifically discussed as anterior transverse arch and the posterior transverse arch. Anterior transverse arch is complete, whereas posterior transverse arch is incomplete. We will be discussing longitudinal arches first, and later on we will be discussing transverse arches. The arches, medial longitudinal arch, it is mainly for mobility, and the lateral longitudinal arch, it is mainly designed for stability. So you can see here the arch, medial and longitudinal. These are the weight bearing areas of the sole. Mainly these are over the calcaneum, the head of first metatarsal, head of fifth metatarsal and head of rest of the metatarsals. These are weight bearing areas of sole. Now we will remove the skin and discuss medial longitudinal arch. It is mainly formed by the different bones and the joints connecting these bones together. We have to note that the phalanges, they do not take part in the formation of arches, and the arches are even present since birth, but they are hidden under the pad of fat which is present in the newborn. So we are going to hide the phalanges and we are going to study the medial longitudinal arch now. As you can see, it is mainly formed by the tarsal bones and the metatarsals. We will see the constitution of medial longitudinal arch. Before going into the details, let us note that it is a high arch. Medial longitudinal arch, it is a high arch. It is more mobile and flexible than the lateral longitudinal arch. Now we are going to see the lateral longitudinal arch. So this is the lateral longitudinal arch, which is low and less mobile as compared to the medial longitudinal arch. Here we are going to see the constitution of medial longitudinal arch. You can see in the green color, the bones taking part are shown. It is talus, navicular, three cuneiform bones, medial, lateral and intermediate cuneiform, and first, second and third metatarsal bones, and medial half of the calcaneum is also taking part in the formation of medial longitudinal arch, which is shown in the frame. So it is a medial half of the calcaneum. It also takes part in the formation of medial longitudinal arch. For each arch, we discuss anterior and posterior ends, anterior and posterior pillar. Then we discuss summit of the arch, which is the highest point of the arch. Then we discuss the joint of the arch or the keystone of the arch, main joint of the arch and keystone of the arch. So we are discussing these details in next frames. So ends of the arch, anterior end of the medial longitudinal arch, it is formed by head of first, second and third metatarsals, whereas posterior end it is formed by calcaneum. Keystone of the arch is talus, and summit or the highest point of arch, it is formed by the superior articular surface of the talus. It has been shown in the frame. The anterior pillar, it is long and it is rather weak pillar. Anterior pillar, it is formed by talus, navicular, three cuneiform bones and first, second and third metatarsal bones. Whereas posterior pillar, it is short and strong. It is formed by medial half of the calcaneum. Main joint of the arch is talocalcaneo-navicular joint. So in the next frame, we will be seeing the talocalcaneo-navicular joint. So talocalcaneo-navicular joint, you can see the ligaments which are connecting or supporting this joint. Now we'll be discussing lateral longitudinal arch. Lateral longitudinal arch, it is mainly formed by the calcaneum, cuboid, fourth and fifth metatarsal. So we have removed the talus and navicular. We have removed talus and navicular. Once again, please see it carefully. The lateral longitudinal arch, it is formed by calcaneum, cuboid, fourth and fifth metatarsal. Anterior end of this arch, it is formed by head of fourth and fifth metatarsal. Posterior end, it is formed by calcaneum. We know that anterior end is long and weak and posterior end is short and strong. Keystone of the lateral longitudinal arch is cuboid and the joint of the arch is calcaneo-cuboid joint. Anterior pillar of the lateral longitudinal arch, it is formed by cuboid, fourth and fifth metatarsal. Posterior pillar, it is formed by lateral half of the calcaneum. Summit, it is formed by superior articular surface of the calcaneum. We can see here the superior articular surface of calcaneum which articulates with talus bone. Main joint, it is calcaneo-cuboid joint, which is a saddle variety of synovial joint. You can see the ligaments connecting the bones together. What are the factors maintaining arches? Factors maintaining arches are mainly bony factors, which is shape of bones, staples or intersegmental ties, which connect the small segments or the bones, that is tarsals, metatarsals, to each other. Then we have the tie beams. Tie beams are basically the long ligaments or the tendons which connect the two ends or two pillars of the arch. Slings, these are the tendons which keep the summit of the arch, or rather the arch, they pull it upwards and thus they are important for maintaining the shape of the arch. Bony factor is not much important in case of the longitudinal arches. It is important in case of the transverse arches. Now, what are the staples or intersegmental ties for medial longitudinal arch? These are mainly the spring ligament, which is plantar calcaneo-navicular ligament. It is a very important ligament which supports the head of talus, and it is a unique joint made up of three bones. In this, the navicular and calcaneum, they are going to form a socket, whereas the head of talus, it is going to form a ball, and the socket is completed by the spring ligament. So this is a spring ligament supporting medial longitudinal arch. On the lateral side, the ligaments supporting or the staples or intersegmental ties are formed by first short plantar ligament, which is connecting calcaneum to the cuboid, and then we have superficial to it long plantar ligament. We can see it is again connecting the calcaneum, cuboid and the bases of the metatarsals. So these are long and short plantar ligament which are forming intersegmental ties of lateral longitudinal arch. You can see here how they are located. Tie beams. Tie beams we have already discussed. They connect ends of the arches. We will see the tie beams of each arch. The tie beam is basically formed by the muscles of first layer of sole, which is covered by the plantar aponeurosis, So the muscles of first layer of sole, what are these muscles? We know that these muscles are two abductors and one flexor. Two abductors are abductor hallucis and abductor digiti minimi, and in between there is flexor digitorum brevis. These three muscles, these are covered by plantar aponeurosis. So here we see the central thickened part of the plantar aponeurosis and thin peripheral parts of the plantar aponeurosis are also visible. What are the slings which keep the arch pulled upwards and maintaining the shape of the arch? So these slings for medial longitudinal arch are basically tibialis posterior from the posterior aspect, flexor hallucis longus and flexor digitorum longus. From the posterior aspect, these tendons, they keep the arch pulled upwards, thus maintaining the shape of the medial longitudinal arch. In case of the lateral longitudinal arch, we have got the tendons of lateral compartment. These are Peroneus brevis and Peroneus longus. Additionally, tibialis anterior also supports the longitudinal arches. Tibialis anterior inserting into the base of the first metatarsal. These are slings which are supporting the medial and lateral longitudinal arch, keeping the arch pulled upwards and maintaining the arch. Next, we are going to see the transverse arches, for which we have to take a cross section across the metatarsals. This is the front view. We can see the concavity of the transverse arch. In case of the posterior transverse arch, only the lateral end is touching, but the medial end is not touching the ground in case of the posterior transverse arch. So it is considered as an incomplete arch. It is complete only when the feet are placed close to each other. Then we have anterior transverse arch. We can see the head of first metatarsal and the fifth metatarsal. They are touching to the ground. So it is a complete arch. Anterior transverse arch is considered as complete arch. Anterior transverse arch is formed by heads of first to fifth metatarsals, whereas the posterior transverse arch, it is formed by tarsals and base of metatarsals. Bony factor, it is important in case of the transverse arch. We have already seen, because the cuneiform bones, these are wedge shaped with a broad base which is directed dorsally, and the apex is directed towards the plantar surface. So we can see here the base is broad towards the dorsal surface and the apex is pointed towards the plantar surface. Similarly, the bases of metatarsal are also these are also wedge shaped. We can see here the intersegmental ties for the transverse arches. These are interosseous muscle, the plantar metatarsal ligaments, and the ligaments which are connecting metatarsals to the tarsals. These are acting as intersegmental ties or staples. The adductor hallucis muscle, which is shown in this frame, it acts as a tie beam connecting the lateral and the medial end of this transverse arch. So transverse arch will have lateral and medial end, and the longitudinal arches, they will have anterior and posterior end. So these two ends, and lateral and medial, these are connected together by the adductor hallucis muscle. The slings for the transverse arch is Peroneus longus muscle, which is extending from the lateral compartment. It grooves the plantar surface, it travels along the plantar surface and reaches up to the base of first metatarsal on its lateral side. And the tibialis posterior muscle, it is also forming a sling to maintain the transverse arch. So that is all for the medial and longitudinal arches as well as the transverse arches. Thank you very much for watching the video. For other videos, you can refer to our YouTube channel playlists, Easy Anatomy for Medicos. Thank you very much.